Hi, I'm Jonathan Drapkin, and I am the President and CEO of Hudson Valley Pattern for Progress. This is our second in the series of governing during the time of COVID, sponsored by the Delaware Engineering Group. It is also sponsored by Ulster Savings Bank, Marshall and Sterling Insurance, Zarin and Steinmetz Law Firm, Keenan Bean Law Firm, and Hudson Valley Federal Credit Union. Joining us today are County Executives Marcus Molinaro of Dutchess County, Steve Neuhaus of Orange County, and Pat Ryan of Ulster County. If you were to ask me last year when we did this event, which was the first time we tried a virtual event, that 1 year later, we'd be all back here together still doing it virtually, I would have said impossible. I also would have said that there are 545,000 people who have died from COVID. Many times that people who are what we refer to as long haulers, people with symptoms, and are still suffering, even though they have quote unquote recovered. But here we are 1 year later, and the virus is still with us, yet things are looking up. We have the virus's transmission has actually greatly reduced. Vaccinations, something we never would have thought of would have been even possible a year later, is happening throughout the country. 14% of the country is now fully vaccinated. And so the economy is also starting to pick up. Look, from a full shutdown, which we had to experience, to reopening it. There was no playbook, but we're certainly figuring out how to get it up and running. But there are many issues. But today and this afternoon, we're here to explore these with three county executives that I've gotten to know really well over the time. And I look forward to conversation with the three of them as we explore how we're doing in Dutchess, Ulster, and Orange counties. Hi, guys. Hi, Marcus. How you doing?
So far, so good, Jonathan. Thanks very much for having us.
You're always welcome. Steve, how are we?
Good afternoon. How you doing, guys?
And Pat, how are you?
Good afternoon. It's spring. It feels good. I think we're all feeling more optimistic every day.
So let's start with, it's almost impossible to figure out how to pick this apart. I know the three of you almost talk daily, and maybe that's one of the really nice things, the collegiality that has occurred between three counties looking to work with each other. What worked? I mean, what are you proud of? That you look back over the year and you say, we did a really good job on this part or that part. What worked?
You gonna pick on somebody first to go?
I could. All right, Marcus.
Thanks a lot. I appreciate it. Our counties did. I mean, but let's be clear. The county governments who, by the way, in this state are responsible for responding to public health crises worked. Public health departments, emergency responders, sheriff's offices, public dispatchers, volunteers through our medical reserve corps, and even the county leaders worked. We worked together like never before. And so, I mean, for me, and we talked about this, a year ago. I mean, Pat's very first positive confirmed case was an Ulster County resident in Dutchess County, and I still recall that Sunday morning phone call where he said, "You want the good news or the bad news?" I'm waiting for the good news. But no, in fairness, and our healthcare networks and our public and private healthcare providers, we worked. And work together in ways like never before. Now, that's not to say we were perfect, that we didn't make mistakes, that there weren't learning experiences, certainly all of that. But I will tell you the collaborative approach that has been underway for 13 months now is unlike anything I've experienced, and I've been in government for 25 years. And certainly as a community member, I think residents and businesses will be very, very proud of the fact that we did work, and we work and continue to work together to confront what is the crisis of our lifetime.
Steve?
One of the things we do on a regular basis in Orange County, in particular Rockland and some of the other southern counties, Putnam and Westchester, is we train for an apocalyptic event at Indian Point. So ever since I've been county executive and before me, we have these regular drills with an apocalyptic situation, terrorist attack, nuclear on the plant, a release into the atmosphere. And all our command staff, including the Orange County Department of Health and their same ones in the other counties, we drill for these. So that prepared us, in my opinion, better than anything. But going back to what I think, Jonathan, you said, and Mark, I wrote peer support. On a regular basis, Pat, Mark, Ed Day, the other counties, Josh, the county manager in Sullivan County, we would encounter these questions, these problems, and we'd be like, hey, what are you doing over there in Dutchess? Pat, what are you doing up there? And in addition to that, what Mark said, it worked as county government. We tried to, when there was like the school sports rollout, rather than have each one do a willy-nilly thing, we came up with a collaborative, unified message and approach so people could see, and it was very user-friendly. They didn't turn it like, well, Ulster County is doing it this way. Why isn't Orange doing this? Why is Westchester doing that? So we've worked very well together. The last thing I'll say, many of us, including me, do these fireside chats. So I think the federal government and the state government in many ways failed, and the message wasn't clear. We were able to say, here's what's going on in Orange County, how many deaths, how do you get a vaccine, how do you get a test, who's in the hospital, where are we? Where the hell are we? Are we getting out of this? Are things getting better? So those things collaboratively, those things I think worked.
All right, Pat.
Yeah, I number one, hi everybody, and Jonathan, thanks for hosting us. I can't believe it's a year later we're doing this the same way, but we make it work. Just to build on that, I think for me personally, I was only 6 months into office. So what worked for me was to have Stephen and Mark and other more experienced colleagues to lean on. So I want to thank them, and you too, Jonathan, and your team for that. And then I think beyond county government stepping up, which we definitely did, doing things none of us ever, well, maybe imagined hypothetically, but maybe didn't realistically imagine. I think our whole community stepped up. I mean, we talk often, the three of us, about, I wish I could share those moments that I've witnessed of individual residents and leaders in our community being really selfless, putting themselves at great risk, whether that was delivering food to homebound seniors or designing face shields in the very beginning and face masks. I mean, we even forget probably some of these things because it's been such a crazy year, but I think our region really led, both, in formal ways, being innovative with our government response, but we did some really innovative, cutting edge things as a community in figuring out kind of what I would call hacks to the system, because the systems weren't really working, and we were on the ground having to figure out how to kind of work around some of those challenges. So I'm hoping to take some of those lessons learned and carry them forward, and not kind of go back to some of the old, more rigid and bureaucratic ways.
I think I kidded you last year about, you've been on the job for X number of months and this occurred. Well, now the dominant portion of your career as a county executive has been governing in the time of COVID. But, when you say some of these things worked and like to carry them forward, anything in mind?
Can you see how many more gray hairs I have? That worked. No, one thing we did that I know everybody did some version of, within a week, we started this thing called Project Resilience, and we worked to raise community funds and mobilize a few hundred volunteers, which turned into a few thousand volunteers, and get over 100 restaurants making meals. And then we paid those restaurants to make those meals, and then we delivered them to people in their homes. And that's one of the things I look back on and I'm most proud of. I mean, we delivered now well over 500,000 meals to homebound folks at risk. And that was all done on the fly, building a new system, sort of the proverbial building the airplane as you fly it. So that's one that we're building on and saying, how do we replicate those kinds of approaches in other aspects of providing critical services.
Really, there was no playbook. I mean, you know, for you, Pat, for you, Steve, military training maybe was the closest you got. Marcus, years of government experience at different levels probably helped you to figure out in many ways, how am I going to address this and connect the dots? And we'll get to connecting the dots in a minute, but Steve, anything you want to take forward from this experience in a positive way?
Look, I think I look at this almost like a mobilization. Like Pat will say this: you miss your friends when you were away. Like some of my people that I was in Iraq with 2 years ago, I was in Iraq. A lot of these guys say, Steve, Commander, I wish we were back in Iraq. We have gelled here, and I think that Mark and Pat had the same experience. Like I'm at a pod. I'm not at some Navy thing here. I just use this flag as a backdrop. But we're going to vaccinate about 2,300 people here today. We did 2,400 yesterday, and it is a group of some county staff, but then also a huge contingent of volunteers. And we do this every day. I work them very hard, as I'm sure my colleagues do. Last night, I had 150 people standing outside my window here in the rain, begging for a shot. And I asked all my volunteers that were working for 12 hours, guys, can you stay another hour? I know you've been working 12 hours. Not one of them went home. So moving forward from here, we are better prepared. And I think we were prepared, but we're always constantly refining ourselves. So there's a lot of lessons learned. Like Pat said, we had Meals on Wheels in Orange County collapsed. Meals on Wheels are mostly delivered by elderly people in your community. They're scared as hell in the beginning of this, or they're getting sick. So county government had to fill in these holes, whether with volunteers, whether with the community foundations, generating money. So there's a lot of lessons learned. The county, New York State Association of Counties asked each county around the state to put together a good one, each of a chapter. And it's filled with positive lessons learned and negative stuff. You know, I know we're going to get to that in the next topic, but that's another thing we have to move forward with.
And Marcus, look, you know, long before this, you implored us to think differently. And it had always been a motto of yours to say, you know, how do we design things differently? Are there things that you learned from this that you'd like to take forward?
Well, I mean, listen, I'd be wrong not to just acknowledge what Steve and Pat have both already offered. I mean, first of all, people rose to an occasion like never before, and even just those individual successes and stories need to be replicated. In fact, in a moment where, frankly, we're spending a lot of time, and believe me, there are beyond the pandemic, we were dealing with civil unrest and issues of criminal justice and reform. We were dealing with political upheaval and unrest. I mean, a lot of you couldn't have asked for more, the confluence of more high tension, high anxiety issues all at once. Admittedly, we seem to be feeling a little bit of that today. Still, now that said, even in the midst of all of that, there were beautiful experiences and expressions of gratitude, of resilience, of hope, of help. I mean, cats and dogs loved each other for a moment in time. The Republicans and Democrats were actually talking together. There were things that those are all, and we still are. But my point is that, those aren't, you can't say, hey, I learned to use this new tool. That's just the human nature that, frankly, if we can hold on to a little bit of it, we better and put it into practice and use it as a vehicle to achieve other things, to think differently in other areas. Absolutely. But I will tell you, from a practical sense, just this. I mean, I kind of hate it to some degree because I can't get away from meeting. But we are using tools like this, Zoom and otherwise, and other tools to interact in ways we never have before. Staff being able to kind of brainstorm together in ways that haven't happened. And since I am the one with 25 years of government experience, I can say quite candidly, although I can't imagine the military is much different, too often these entities, departments function in silos. Just relying on the technology has helped us take what too often is siloed and bureaucratic and integrate it in a way that I think we're being forced to work more collectively, collaboratively, and efficiently. So I will tell you, we're going to use these tools. I mean, like it or not, we're going to continue to use, and I don't mean to boil it down to just Zoom, but using the tools that we've had to use to keep functioning. I think we're going to continue to put them into practice because it allows people to function better. Mom or dad have a daycare issue. I don't need them in the office at that very moment for certain services. So let's make sure we accommodate that. And so, I will tell you, as a dad of a child with a disability, my daughter needs ongoing services. Some of it has had to happen this way. Why shouldn't we be providing early intervention, special education services in this way? So a lot of the tools that we've learned to use out of necessity can be used not to eliminate the socialization and get back to normal, but we're going to continue to put into practice these tools to augment what we already do.
I think it's a really good point, that the notion of using technology in a positive way, that we've all learned ways to integrate it into the delivery of services. I want to make a point, though. It's funny you say, Democrats and Republicans, cats and dogs. So the first session we did with 3 mayors, and 2 were Democrats, 1 a Republican. The 3 of them worked together throughout this process. You would never have known there was a political distinction. In this country that is so polarized, the 3 of you, I am well aware of how often you collaborate. If really it was Democrat and Republican, it was in name only. The 3 of you transcended that and said, we've got a job to do. And I commend really all the people that left that behind when we look back over a year and say, what an incredible year of polarization. Now I'm going to use that to sort of say what didn't work. And Marcus, we'll start with you, only because that was just the rotation. There wasn't.
Oh yeah, just by chance. I'm going to say the things Pat doesn't want to say. No, we all have our observation. I will say, from an emergency response perspective, you can never respond to a crisis from the way top down. It just doesn't work that way. It just doesn't. And so again, no military experience, but at some point, I assume the generals have to rely on their field commanders. At some point, the people at the top have to integrate the mission, right, and develop and deliver the mission with your local, with your people on the ground. So I will say what you expect me to say, but it is truthful. The state of New York micromanaged from the top down on too many issues. And there were moments, great moments of collaboration, and the state has had to do some things that they've done really well and that they never have done before. But from an emergency response structure, we should have been meeting regularly with state leaders in a collaborative way, talking through the logistical challenges on the ground, developing policy together. As best as anyone, that's not how it happened. Several governors across the state met with county leaders, big city leaders on a weekly basis to talk through some of the decision making before the announcements get made. Because again, we're the ones having to kind of logistically deal with it. So I'm being respectful in saying it, but again, the reason that we fight fires with local fire departments is because you wouldn't send Congress in to put out a fire. You just wouldn't. So you start, and we know this, if there's a fire in your neighborhood, you start with the fire company. When that exceeds the capacity of that company, you bring in mutual aid. When that exceeds the capacity, you bring in mutual aid. And sooner or later, the federal government has to come in through FEMA and other resources to assist. There was too much top-down micromanaging of decision and policy without integrating the delivery. And that, I think, was really, it just is problematic. But I'll offer you, it shouldn't come as a surprise because it's basically how the states responded to snowstorms and other things. So, but I will tell you that made it complicated and difficult, and it caused conflict where it wasn't necessary. And that, I think, if anyone's learning lessons, we really need to trust and empower our local leadership, me, my public health departments, Pat and Steve, our emergency responders. We have to be able to do that. The state of New York has to rely on the level of government that they have empowered, they have mandated, they have legally required to engage in that effort in a collaborative way. That was, I think, the biggest challenge and likely among the largest of, confluence of chaos, if you will, was just that. There just wasn't a trust from the top down and an empowerment of those people on the ground, county governments, who ought to be engaged in the decision-making with the state.
I think what you're referring to is that I was a member of the regional control room, got to listen to many of these discussions. And so, yes, I'm well aware.
And I want to take more time. I just will say this, though, and let's be clear. the federal government didn't have a plan of action in place. So I don't want to dismiss this and seem partisan. Yes, the federal government had certain resources, but the distribution of PPE, the establishment of nationwide testing, that just never happened. And so states were scrambling to get it done, but you can't do that from the top down either.
Pat, what didn't work?
Yeah, I will, in a bipartisan way, agree with Mark on that. I think drawing on principles of, just basic crisis management, command and control, bottom up works in an uncertain, ever changing environment. You can't do top down. I mean, and we've all seen that in different business and other venues. The other thing that I think that I reflect on as at least a personal failure, and I think, or an area for improvement, is expectation management. I think that at a few key phases of our response, in the hopes of being positive and optimistic, and the goal to be showing progress, we might have set expectations that then were unreasonable, that we couldn't meet. And I think vaccines are an example of that, where we were all so excited to see the vaccine be approved so quickly, and the public was, and we focused a lot of our kind of communication time, and the press focused on the first people being vaccinated. And then I think what happened is folks just expected that, okay, well, the first people got it, so I should get mine, tomorrow or next week. And we didn't set expectations well enough anyway, that this is one of the most complicated things we've ever done as a country, as a state, as counties and local governments, and really help people understand that it was going to take some time, that we're going to have to make hard prioritization decisions based on limited supply versus demand. And, I'm sure you both got the calls. I mean, we had an unprecedented number of calls and concerns and frustrations from folks early on in the vaccination process who were frankly desperate for good reason and felt like they weren't getting what they needed. And so I think that's on everybody. And I definitely own my share of that, to take that forward as a lesson, that just the classic, under promise and over deliver is something that we can always, be optimistic, but not set those unrealistic expectations for folks.
Steve, your thoughts on what didn't work, or what should have been done differently?
Every interaction I have ever had with Governor Cuomo has been positive. I thought he listened to me. We've had discussions on whether it be on a project or even handling the Orthodox Jewish community during the crisis. But I think the state failed epically. And when something goes wrong in Ulster County, it's Pat Ryan's responsibility. Same thing with Mark and Dutchess. That's what comes with our job. We are the people in charge. We are the CEO of the counties. He's the CEO of the state. I feel the state has failed us. I feel that a lot of the times we were not listened to, and that might have been the staff has no direct, and nobody knew what was going on, and it was directly he was controlling things. But from early on, we had many problems. And the way I function and my team functions in Orange County government is no one is coming. It's up to us. I had to buy 20 ventilators for my county. Most of the PPE I bought myself early on. I shared it with one of the counties south of us because they were short the first couple months. So I think we were failed. I agree with Mark and Pat. The federal government was no better in any means. But, you had Walmart fully opened, but Main Street was closed, crucifying local business. And nobody answering to us, nobody listening, saying, let's let them do the same type of format as Walmart or these other places. Nope. The other thing I will say is right now, I reported 13 people dying yesterday, 13 people in Orange County. We got the short end of the stick. They talk about an equitable distribution of vaccines. It didn't happen. It didn't happen. And the result of it is people died. That's the problem. That's the problem I have. I take this very serious, and I believe in the chain of command, and I believe in accountability. Now we're vaccinating. I've gotten more vaccinations. My county health department We have vaccinated more people ourselves than any other county in the Hudson Valley, including Westchester. We've done 43% of the vaccinations that take place in Orange County were done by us. Westchester had a state site. I'm not criticizing them. We now have a state site, but and I do appreciate them having it here. But that gap that we had has cost people's lives, Jonathan. So I take it very seriously. I think that the state of New York is not a role model. We have the second most amount of deaths in the United States, second to California, which has double our population. And it was because in the beginning, there was confusion over closing schools, what to do with the Orthodox community in New York City, Rockland County, and Orange, where we had the biggest clusters up front, no leadership. We were playing political games that came directly from the state when we should have had de Blasio, Ed Day, myself, and the governor on a call immediately in March of last year, rather than what we did was we dicked around for a week and we kept schools open when everybody else in the country shut down, even on the West Coast, Washington State. So that's where the state failed. I think we've got the county government, like Mark and Pat said earlier, did what we were supposed to do. We are where the rubber hits the road. But I think that there was a lot of lack of leadership coming from top down.
All right, let me pivot from that.
He was very, very calm. I wish he would open up.
Pat and Steve, you now have facilities that are like the Westchester hub. Do you want to put a pitch out there for volunteers and other people to help you? Because there are people now coming to your counties. Marcus, I'll let you frame it any way you want, but I know that there are 2 new facilities, relatively new. Do you have enough volunteers? Are there more people that could be out there? And therefore, anyone listening today, we can put the word out.
Yeah, we're going to need volunteers for a lot of different things as we not only finish vaccinations, we've vaccinated about 30% of the population. The next 70% is going to be much harder for a whole bunch of reasons. So we definitely need volunteers. We're actually paying a stipend to respect folks' time. But I'll say, even just doing one shift working at a vaccination clinic, you will feel better about yourself, our community, our country. Like, people coming through the sites are crying tears of joy and relief. And to be a part of bringing that to people is a really powerful and positive experience. So if you have any time to do that, I think it would obviously be a great service and also rewarding personally. And you can go on, at least in Ulster County, ulstercountyny.gov/volunteer, and we'll take it from there.
Steve, how do they do it in Orange?
So we do it with orangecountyGov.com, and you go onto our health site and it goes to the Medical Reserve Corps. So for people listening, you don't need to be an RN or a doctor. We need just as many ushers or people helping and people that speak Spanish so they can help, help people fill out the paperwork. But like I mentioned earlier, and I think what Pat and Mark will echo with me is, we're going to miss, it sounds crazy, we're going to miss doing this because it's so rewarding. Like Pat says, people are crying, people are emotional. So the people that volunteer or work in these pods with us, it's a very rewarding experience. And we are definitely going to need the support. So if you go to orangecountyGov.com and you go onto our health department's page, sign up on the Medical Reserve Corps, and it asks you what your expertise is. If you don't have anything, we'll have a job for you.
All right. How did things change in the last year? And topics that I'm thinking about is, we learned that broadband was not what we thought it was. We had problems with children learning virtually in school, from home. Telemedicine wasn't going to be the be all and end all because not everyone could access it. Remote work was kind of interesting because it added a new dimension to where your place of work was. People are moving up to the Hudson Valley in numbers that we're moving into the second year of that. And the only thing I think will slow it down is the lack of supply of housing. what's changed in your opinion in the last year that might be trends or things that we should look out for in the next couple of years? Let's see.
I'm happy to
Matt,
start.
go ahead.
I mean, I think there's a ton here, but two that I would focus on. One is, I think, clearly when any system gets stressed, you see all the kind of cracks get really accentuated. And you talked about infrastructure as one of those, housing as another one, our education system, frankly, our fundamental economic system. All those things that were kind of below the surface more, although Pattern has highlighted them quite well, I would say, really came to the fore and came to the surface. I think I am very optimistic about us being in a position from federal all the way to local to really invest after 20, 30, 40 years in infrastructure in a way that we haven't for far too long, and 21st century kind of infrastructure, and thinking about it in a broader way, of course, broadband, but also thinking about other kind of concepts of what we really need as that foundational layer from an education and workforce development perspective as well. So I hope that the next big thing we tackle, which I think the White House is hoping to do, is infrastructure, and really between the federal relief bill that we got, which is really sort of backwards looking and making up for the gaps, now we have a chance to really invest in a big way going forward. And I'm sure all of us have lots of specific ideas about how to do that, that we've been dreaming about and working on, and I know we do. The only other thing that I would say, and again, Pattern has hit this really well, the housing, what was a housing challenge or crisis is now like a 5-alarm fire, if that's even a thing, in terms of how bad things are. We just put out with you all, this housing action plan related to Ulster County, and the numbers are just, and I know Mark talked about this in his State of the County, this is going to hold everything back. This is the limiting factor economically. If people can't afford to live here, they're not going to come and work here. They're not going to relocate their business here. They're not going to invest here. So I think this is a thing that we all need to do more work on as a region. I know, our action plan outlined a bunch of ideas, but most of it is going to come down to building more inventory at all levels. And I hope that we can all work on that together. That's the only way that I think we accommodate more new people and energy and ideas coming, but do it in a way that doesn't exacerbate those that are already struggling.
On the housing front, I'll just add that it seems it's actually we used to focus almost exclusively on affordable and workforce. That's got exacerbated because at even $15 an hour, it is hard to find housing if you're making that much. Then there is, like in Steve, I'm thinking of like Montgomery, where people are working in warehouses. There's the challenge for the people at that income level. And then at the higher income level, there is an absence of housing where people have decided, gee, I could make a whole lot of money by selling my house right now, but they don't have a plan. They think there's some other magical house out there that they could get for less money, but this has reached a crisis level. But
I just want to quickly, just literally a 10-second point. All of us throughout the year, I know I thanked at every briefing our frontline workers, right, that put themselves at risk. This is a chance to actually honor what they did and make sure that if you're a grocery store clerk, you're a nurse or janitorial staff at a hospital, or a public works worker, whatever, you put yourself at risk, you should be able to afford to live in the community that you just protected. And that's not happening right now for the majority of people. This is not like a small set of people. So we need to remind people of that and use that as an impetus for action. That's definitely what we're planning on here.
Marcus, you're always on the cutting edge of trying to figure out what comes next. And, what makes Dutchess so interesting is it's urban, it's rural, it has kind of a mixture in between. What are you thinking about are the next things you've got to tackle?
Well, I think as Steve and Pat's already said it, I think Steve will admit, we are strangely optimistic. I don't want folks. And I don't think it's wrong to be that way. I think that the outward push from the urban centers, New York City, is providing us an economic opportunity. I think the reliance on technology has allowed employers to move out of central locations and be in places, quite frankly, where the public may want less density, may want to be in a place where they have access to some of the cultural, recreational, food, drink activities, but aren't in a massive, densely populated city center. That is providing us economic opportunity, and guiding it in a way that is effective really has to be something we focus on now. I've in elected office, I've lived through a few of these outward pushes from New York, and we always tend to be a few months, if not a few years behind. We're catching up. This is a real moment right now, I think, where we could actually guide it. So the federal government coming to an agreement on infrastructure investment is necessary. If we're going to guide development, the way to do that is water, sewer, broadband, and other infrastructure investments. Drives down costs for the developer, time and planning and review processes for the developer, but also allows us to gain density where we want it, redirect from some of the more environmentally sensitive or rural communities. So we have the tools like right on the horizon. We got to get them in place now so we can guide the next phase of growth. That's I think important. I agree with Pat. Housing is the biggest challenge. Now, I have a community with an aging housing infrastructure. We were built in and around the 1970s and 80s. So our housing stock is around the 1970s and 80s. I don't think it needs to be said that there aren't a lot of people, moving into a community looking for a 1970s subdivision. But that said, we need that housing ladder. And so that's, by the way, at the end, at the bottom, those who were forced out of homes, dealing with housing instability, dealing with homelessness. We need new models, because trapping people in homelessness for their lives is not healthy. It's not productive, and it ain't working. And you look any place else in New York, we have a homelessness crisis, and it is mostly because we have prolonged homelessness, and we're trapping people in that level without being able to transition upward. So it's homelessness into transitional, into accessible, into affordable. But then we need the middle income and higher end luxury, because I need to be able to move we need to be able to give that housing ladder opportunity to everybody. But that, as you know, is heavily reliant not only on infrastructure and our work, but on towns, villages, and cities, and home rule authority, and their willingness to look at zoning in a way that's a little bit more creative, not to transform communities, but to do what's best for the people who live there. So that's important. I would also say, and I'll take this opportunity to say that one of our biggest failings as a nation was for our most vulnerable, those seniors, frail, and living with health conditions, whether in a congregate setting, nursing home or not, and those with disabilities. And let me tell you that we ought to be ashamed of the way we've dealt with it. Now, we locally did the best we can to provide support. Community organizations, not-for-profits, businesses, our healthcare community, I can tell you, wanted and still wants to do the best. But we better figure out the way to summon the courage and capacity to educate our kids, no matter the crisis, to give them the socialization and the investment in education, no matter the crisis. We better figure out a way to not have our loved ones in nursing homes be afterthoughts, but rather central in our lives and decision making. We better figure out a way to take those with disabilities, and instead of by the way, and I say this bluntly, the state of New York put a target on the back of those individuals and was willing to accept lack of special education, lack of intervention services, lack of disability support. They were willing to accept that. And that is criminal, Jonathan. It is criminal, because these are human beings that rely on us, government, to provide that support. So what's next? What's next better be a way to figuring out a way to provide for our most vulnerable, no matter the crisis. Because at the moment, we failed in that as a society. And that isn't the human failing. That's not the folks watching. It's not the care providers. It's not loved ones. It is government's job to figure out a way to, no matter the crisis, educate our kids who will live with trauma because of this experience, support those living in settings that are our responsibility, and those with disabilities relying on us. What's next needs to be a willingness, be creative and courageous in dealing with that. I don't have all the answers, but I can tell you we're going to spend a lot of time figuring out how not to allow these kinds of crises to so interfere without those lives that in some cases ended those lives.
Steve, you guys were en route to being one of the tourism highlights between Legoland, maybe even small casino, but it's much more than that. And so what's next in terms of
Jonathan, I want to interrupt. I apologize. There is no truth to Steve's offer to build all new homes out of multicolored plastic blocks. Just want to offer that.
Primary colors. So, look, at the end of the day, this pandemic is going to permanently change people in this country. It already has, how they think, how they work. I think the educational system, the schools, has been less than desirable. I have 3 kids in the school system that have not gotten the best year because of remote. It just doesn't work as well. These type of Zoom meetings, myself and the rest of the people around the state, I think they've actually worked out better. Being able to see Pat, being able to see Mark, the other county execs, our health department staff, having dialogues that worked. But what it also changed, though, is we had General David Petraeus. I brought him in as a speaker to the county execs meeting a couple months ago that the 3 of us and a bunch of our colleagues were at. He works for KKR and handling their international investments. He was out of Manhattan. They're not sure if they're going to come back there again. They have been conditioned, like many companies, to work remotely. What has that done? A lot of people that like the quality of life in Orange County or Dutchess County or Ulster or Sullivan are now living here. What we've also seen, for the last 12 months, solid use of our outdoor recreation, hiking, parks. People from this area or people from outside felt at least comfort in utilizing the beautiful open space and parks we have. So you're going to see, I think, nothing but a constant growth in there. Going back to your question about tourism, Legoland's slated to open. I was on the phone with them today and talking about their hiring patterns, how everything's working. We have a dinosaur park coming. We have all these existing economic development things that are continuing to function and not go under. But going back to some of the opportunities is infrastructure. There, Jonathan, we've been talking about a 3rd lane on 17 for 20 years. The best opportunity to get that done to handle traffic mitigation is with the current crisis and with the investment coming from the federal government in infrastructure. So look, I think there's a lot of opportunities. You were talking about housing. We had a housing summit last week with the Alliance for Balanced Growth in Orange County, talking about where the opportunities lie, what obstacles exist. But I am definitely optimistic about going forward on this. And the best thing about it is this isn't like a kumbaya with market. The reason why the 3 of us are optimistic is because we have to be. We all have young kids at home. We owe it to them and we live for them. And we're personally friends outside of this. Mark and Pat and I, we talk constantly about our communities and the future. So we believe in the future because we know we have that, and not only for the community we represent, but we live it ourselves of who we are. So I am very optimistic where we go forward from here.
Well, you've each mentioned different aspects of the infrastructure needs, and some are forward thinking, and we have to upgrade broadband or 5G or take your pick. Some of the ones that people don't get very excited about, but they're old. I mean, not just the housing markets, but sewer, water. They're not very exciting, but they're pretty old and in need of repair. Yeah. So people got very upset with Washington doing 1.9 trillion, with a T, on the latest stimulus bill. They're now talking 3 trillion for what is an infrastructure bill. There'll be a lot in that bill because we all know how Washington works, that will say, what is this? This has nothing to do with infrastructure. But is there things that, 3rd lane is one thing you mentioned, Steve. Are there other programs that you guys have been thinking about? Just give us the money and we know how to spend it in our own county when it comes to infrastructure?
Well, infrastructure. And the truth is we're the mechanism to put the money on the ground anyway. And the last time we did a stimulus package, the state of New York got it so screwed up, we were doing guide rails. Remember that? Because we didn't have the ability to move projects. Why? Because they didn't empower the local government, the counties with the municipalities to make shovel-ready projects work. Now, mind you, I don't know where we're coming up with the cash, and we ought to be very concerned about national financial policy. And we can spend another time having that conversation, but we better be respectful of that, because right now it isn't just our grandkids going to be paying this back. It'll be our grandkids' paying this back, and that's a problem. That really is. And there never seems to be a conversation from anyone about, well, if we're going to spend more, how do we efficiently save dollars? That said, and to your point, Jonathan, you said it. We all know how Washington adds things. We don't get to do that. Nobody says, oh, well, we know how you need to pass a highway bond. You have to add stuff that has nothing to do with highways to it. I mean, that's not how we function. So if you want an efficient delivery of some of those dollars, put us in action, get us onto the ground working. So highway, we haven't built roads in generations, more efficient, effective highways. Streets and sidewalks are eroding in the Northeast, in the state of New York. Invest effectively there. High-speed internet, absolutely. I mean, we know that we need broadband access. We're going to use some of the ARP dollars for that function in Dutchess. Water and wastewater, absolutely. I'll tell you, we have a pending environmental crisis in this state because we've never effectively expanded wastewater. Using water and sewer as a driver for a development, good, drives down time, cost, but also allows us to take old, aging septic and water and sewer infrastructure, modernize it, make it effective, make it efficient, make it clean. So whether it's Hyde Park in Dutchess or out in the village of Pauling, we need to move water and sewer to effectively grow and preserve those communities. It's not sexy, certainly, but I'll tell you this, in New York, we're going to have to work to make it easier to get those dollars on the ground. And God help us, if those infrastructure dollars have to go through Albany to get to the local communities, we'll be doing guide rails instead of investing in water, sewer, and broadband.
Pat, we may have lost you for a little bit there, but I'm glad
Change of location. Pat's,
Let me, I want to go into the couple of questions that have been posed. And Pat, I'm kind of glad you came back here because one of the questions deals with your rather interesting concept of universal basic income. What is it? How is it supposed to work? And just tell us.
Sure. Yeah, and I apologize. My laptop battery died, so I had to do a quick move here. So my apologies for the technical difficulties. So I'm really excited about the opportunity here. Back to some of the original points of we have to be willing to try things that we haven't done before and do things a little bit differently and recognize that a lot of our existing support and safety net systems, I think, are extremely rigid and bureaucratic and often have disincentives. The elegance of the idea of whether you call it universal basic income or guaranteed income is actually a centuries old concept. And however, implementing it in the modern day is relatively, I guess, seen as new. And so we're actually the first county in the country to take a countywide pilot program. And the idea is that, especially after this last year, we saw the value and the simplicity and really elegance of providing direct relief to families and trusting them to do what's right. And that'll change week to week, month to month. So we'll have 100 families starting in a few weeks receiving $500 a month for the next year. And we're going to study that with the leading research institution in the country, the University of Pennsylvania Center for Guaranteed Income, to really assess, is this something that could scale? What are the pros and cons? But I think all of us at a minimum could agree across any ideology and party that our current systems were not up to the task, especially in a crisis. And so to me, it's incumbent on us as leaders on the ground level, kind of in the laboratory of government, to try new things. And so I'm really excited. We had over 4,200 people apply for 100 slots, and that's heartbreaking that we can't provide relief to more. So that'll be starting in the next few weeks.
It's an incredible effort. There's a question concerning here, and I'm curious what all three of your take is on this. You know, you're not responsible for school districts. And, you know, maybe you're thankful for that, but there's no question that if we go into September and we're not back in school, it'll be the third year that will be disrupted. They will be studying this for 100 years. Is there anything that you can say as a county executive to try to get schools open?
Well, here's the thing. We have, I mean, we have all said first, kids should be back in the classroom and they should be safely there. We've directed support and resources to districts to make that happen. The federal government's providing an enormous amount of money. There is zero excuse. There is no longer any excuse from anyone to go into certainly next year without being prepared. And if there isn't a way to do it, it is a failing of the entire system, and that is a New York State responsibility. So get the dollars to districts if they need protection in order to get kids in the room. But we also know this with increased vaccines, with immunity growing, we know that it's safer in a structured environment like a school district, a school building, than not. Not to mention the social and economic crisis that will continue to occur if families have to continue to figure out ways to manage kids being home. You know, we talk about this, and by the way, I'm very sensitive to the fact, and I say respectfully, 3 white men who probably have a degree of means financially, and have spouses who are sainted. You know, they're just sainted. But there are kids in domestic violence. Well, your wife suffers along with you, but John, but there are kids in domestic violence situations, child abuse situations, mental health situations, disabilities. They are getting none of the direct support that they need. This is traumatic for a lifetime. So what do we say? Yes, we got to make it work. New York State, all of us have to find the courage and capacity to get our kids to a classroom. We think it's safe. All of us have said there's ways to do it now. Many of our districts have moved in that direction, but there is zero reason, and we cannot afford to have our kids not in a classroom in September. Zero.
And, you know, because when the CDC changed their guidelines to say, you know, it's okay now for 3 feet, the head of the AFT, Randy Weingarten, her immediate reaction to it was, well, we got to study that. And
just to jump in here, the 3 of us, by the way, early in the pandemic got together before the state and said we needed to close schools. We were, I think, the first 3 or one of the first 3 counties to do that, working with our superintendents. And then a few weeks ago, I know us and I think both Steve and Mark did the opposite and said it's time. We've done the study. Our health commissioners have looked at it. We put out guidance to all our school districts 3 weeks ago saying you can do it with some reasonable restrictions, including 3 feet if needed. And we were ahead of the CDC and felt comfortable with that. And I think we have to balance not just the health risks of COVID, but the broader, as Mark said, mental health and other societal impacts of kids and parents and even educators who are all beyond the breaking point. And if we can't recognize that as leaders and have the sort of moral courage to put that out there, then we shouldn't be in these jobs, in my opinion.
So we have about 3 minutes left. So for the people that put questions and to us, Pattern's going to endeavor to get them answered. So as long as there was a email response, there's a way to respond to you, we will get it. So please don't get upset if we didn't get to your question. With 3 minutes, I'm going to start with you, Steve. You get a minute each. Let's end this on some note of optimism for, you know, what's to come. How do we look at it and try to be optimistic about the next coming, 3 to 6 months?
I am very optimistic, and I think my colleagues are too, because we are accountable for this right now. Every person I see walk in front of this window right now is getting a vaccine. Every major project in my county has gotten a green light to go forward. Festivals, concerts, biggest air show in the state again. We did it last year, we're doing it this year. So all these projects that were on the shelf or were maybe in question if they're going to survive. Look, it's been painful. We have lost a lot. We've lost a lot of small businesses, but we are in a much better place where we are today than we were 12 months ago. It gets better every day. Every day that somebody gets vaccinated, it gets us closer to some type of normalcy. And I look forward to enjoying that as a region as we open up and begin to love this weather and see our society back to normal.
Marcus?
Listen, there is only one direction from here. I mean, frankly, right? I mean, the guy, I am exceptionally optimistic, and it's not foolish, and it's for the same reasons the rest of us are. There is great opportunity now to harness new technology, economic investment, real desire to get back on our feet. But as we do that, we have to remember that there's a lot of damage in the wake of these last 13 months. Lives lost, families torn apart, businesses that had their hopes and dreams. We have to snuffed. We have to be about the business of, as we rebound, and we are, making sure we bring those folks back, that we show them the respect that they deserve, the support that they need, the love that they may have lost. All of that has to be a part of this growth. So I'll be a very theoretical with you and just say, in these moments, and I said this a couple of weeks ago, trust is the currency of leadership. That is the one thing that we have to restore in each other, in our institutions, and that means demanding accountability from everybody. So as we harness the next phase, and I believe there's great opportunity, I really do, we have to learn to talk with each other, communicate with one another, rely on one another, use those great moments that we had these last 13 months and apply them moving forward, that we can trust one another again to achieve some big goals. The only way we're going to the moon is to trust that we can get there. The only way we're going to confront these big problems is to trust that we can. And we need to find ways to rebuild that as we proceed forward.
Thank you, Marcus. Steve?
Oh, I think,
No, he's there. So,
It's Pat's turn, Jonathan. It's Pat's turn. Let the
it's
man
Pat?
speak.
I'm sorry. Oh, Steve went. Oh, that's right. Sorry. Thank you.
no problem. No, I share again, the optimism. I think anybody that's been out on the ground as safe as much as we could with COVID and seen how everybody has stepped up on a human level. That's what I keep coming back to. We got to make the foundational infrastructure investments. We got to make our governments run better. We have to do all those sort of official things. But we all know what makes sort of good to great is the individual people that make up the talent layer of what makes up our region. And we saw that come through in so many powerful ways this last year. I'm so convinced if we can just continue to channel that and remind people of that, we're going to come out of this even better than we came in. And the one specific thing I am most excited about, Ulster County wise, my grandpa worked at IBM for 36 years. Yesterday, I stood literally in the factory that he worked in his whole life, and we had a huge moment where we're finally getting that moving forward after almost most of my adult life. It's sitting fallow. That is going to be really, at least in Ulster County, and I think the region more largely, a real proof point of how we come out of this pandemic stronger and better and more equitable. So I'm excited about that. And then just the last thing I'll say, I'm very excited since Army beat Navy in December that we will repeat that again, and I can call Steve Neuhaus gloating, and maybe we can even see the game in person this year.
I would love to go with you.
I'll stand between the two of you with the beer.
I will just close this by saying that I share your optimism that there is something to build off of here, but it's my job to also say that I got to watch from the cheap seats, the three of you. And I know that you like to give credit to all the people around you, but the leadership that the three of you showed in your own counties and collectively, remember, I'm a regionalist. So to watch the three of you collaborate, I really think is part of this story. It is, all of you would always tell me, come on, it's not about me. But I do want to say that I really, from the cheap seats, got to say you did a incredible job getting us this far. We're not done. We got a lot more work ahead of us, but thank you for joining us this afternoon. And this will be available on our website. We recorded it. And to all our sponsors, thank you. And today looks like a nice day, so get outside.
Thank you.